Hello and welcome. I'm Marcella White Campbell, the Executive Director of Be'chol Lashon. For more than 20 years, Be'chol Lashon has worked to strengthen Jewish identity by affirming the racial, ethnic, and cultural diversity of the Jewish people. Today, we're honored to learn from one of our community's most respected members. Dr. Denise Davis is a trailblazing physician and educator who has dedicated herself to making the healthcare system fair and welcoming for all patients. She teaches workshops in the United States and abroad on diversity, equity, and inclusion in the field of medicine. In addition, she mentors minority students at the UCSF School of Medicine and sees patients at the San Francisco VA Medical Center. Dr. Davis has also been involved with Be'chol Lashon since its founding and is the president of our board of directors. She is an inspiring leader and a true gift to our community. Dr. Davis joins us for an important and timely conversation about race and representation in our healthcare systems, the ongoing COVID-19 pandemic, and the concerns that have arisen, especially in Black and Brown communities, about the vaccine. Hi, Dr. Davis. Thank you for joining us today. I'd like to thank you, first of all, for your contributions to the Be'chol Lashon community, as well as your contributions to the greater Jewish community. And I've been very inspired by your work and your accomplishments, and I'm grateful that you're taking the time to talk to us today, especially in the middle of everything that's going on right now. This is a momentous time in our country. For the past year, COVID-19 has disproportionately affected communities of color and Black communities. And now there's a vaccine available. And yet many Black people are reluctant to take it. And I wonder if you could help us understand why that is and how Black Americans relate to the American medical establishment.
Thank you. I want to first locate myself as a Black Jewish woman and as a mother and as a physician, as an educator, as the daughter of a nurse who inspired me. Her name was Grace. She's now of blessed memory. And her warmth and respect and deep humanism continue to inspire me. On my best days, I channel my mother, Grace. I've been a physician for more than 35 years. And my dedication to the health of my patients, families, community continues to motivate me. And I want to say that putting skepticism about the health system in a social context is so important. That though people talk about Tuskegee and the heinous experiment that was really torture for Black individuals, there is data that indicates that even people who identify as Black who don't even know about Tuskegee have significant skepticism because of in the moment real life experiences with exclusion, disrespect. So this is so important for me to keep in mind as a person, as a physician, as a Jew, as someone who loves health justice, that every interaction that people have with the healthcare system has an impact. And this is why I'm so committed to teaching communication skills for physicians so that they begin the process of respect, empathy, and deep listening in the first few seconds of an encounter. And this has been shown to increase the acceptance of respectful recommendations. We call it adherence in medical parlance, but it's really the acceptance of respectful recommendations as we are as consultants. We know that skillful, respectful, empathetic communication also results in more sharing of decision-making. Dr. Lisa Cooper at Johns Hopkins has done all this work. and has actually video recorded encounters between patients and clinicians. The meetings that are highly rated by Black patients are a little bit longer, and there's more positive affect. So if I said to you, Marcella, it is such a pleasure to see you again. I wish that we could be face-to-face safely during the COVID era. That's very different than saying, well, let's talk about your blood pressure. It touches a different place in the mind and in the body. And that's what I'm aiming for. That's what I'm agitating for. That's what I'm pressuring for. That's what I'm imploring. So I think we have a long way to go in terms of respectful, curious conversations that are not dominating and disrespectful of what people know about their minds and their bodies. And one last thing I want to say is it's not just African Americans or Latinx or Indigenous people who are skeptical. There is a large population of people who are skeptical, and that is a national crisis.
Why do you think that greater group are also skeptical of the vaccine?
Well, if we look at the erosion of trust from the highest levels right down to public education, to a lack of accountability and a lack of apology for when we fail. And in the health professions, I make errors, I make mistakes, we're all human. What we often fail to do is to take into account the impact of our errors, make an apology, and rebuild trust. I know medicine best. I don't know government best, but I know medicine best.
You know, I was wondering, thinking about the way you're talking about how doctors can come into a room and establish trust with their patients, from a personal perspective, my grandfather just passed away at the age of 97. And, in the last 20 years of his life, we spent a lot of time in emergency rooms, in, hospital rooms, in urgent care. And we would often all come to help advocate for him. Many people in my family would come and take shifts, and whenever a Black doctor or a doctor who was a person of color walked into the room, the stress level lowered. With my grandfather in particular, he was just always so thrilled to see a Black doctor. And I wondered, have you had that experience? How does that feel from the perspective of being a Black doctor?
Yes. I've had similar experiences in walking out into the waiting room at the VA where I practice, where African American patients are overrepresented here in San Francisco compared to the population. And I'll introduce myself. I'm Dr. Davis. It's a pleasure to meet you. And the smile and the words that sound something like, oh, it is so nice to see you. And I know that I'm representing equity. Because really, they don't know me yet. It's an imagination that our shared identities will allow for more health justice. And there is evidence that that is a trend. It's not 100% by any stretch of the imagination. But I represent, and it is so important in medicine, in nursing, in physical therapy, social work, occupational therapy, to have a cadre of healthcare professionals who represent the people that they are treating in order to have just the first layer of trust. There are many other layers of trust, but for that very first layer of equity.
Yeah, that's really valuable. Thank you. It's really, again, just that positive feeling. Still remembering
Yes.
that. That's wonderful. Do you think it's possible to draw a parallel between Black Americans' mistrust of the medical establishment and many older Jewish Americans' mistrust of the medical establishment?
Mm. It's a matter of proximity to trauma, isn't it? That my patients in my private practice who are Holocaust survivors, the proximity to that trauma is in the body and in the mind. And we become, if we are really listening, respectful witnesses. If we're listening, taking into account how that trauma is an indelible and often integrated, but always a part of that person's experience. Jews who identify as white have found increasing acceptance. Not 100%. Anti-Semitism is real and a threat. But there is a social advantage to whiteness. And I think opening conversations about that in the Jewish community is an important way of illuminating social context in which we currently live in the United States. So that those social advantages do insulate from ongoing trauma, and the distance from the Holocaust and the pogroms healing does happen. There is some healing that happens. For African Americans who are seeing Rayshard Brooks, George Floyd, Breonna Taylor, just within recent memory, violently killed, unarmed at the hands of law enforcement. That's an ongoing trauma and lives actively charged in our bodies and in our minds. And I had an intern who identifies as Black recently tell me that they now go into the medical education environment with suspicion about who is for them and who is against them, especially based on the violent actions of a white mob in the United States Capitol recently. So adding injury to injury, of course, the social compact has been broken and trust with it.
So much of what you've said today has touched on listening, I think, and on conversations. And do you think about that in a Jewish context? You know, I always think about the Shema.
Yes.
You know, but these conversations and this listening, do you think about them that way?
I attended a week-long retreat twice on listening given by Rabbi Phyllis Berman. She continues to be a teacher and mentor to me. And some of my patients, when I told them I was going to be away for this training on listening, said, "But you're already a good listener." And my response was quite authentic. There's much more to learn. the understanding of getting under and into the stance of the other person to really better understand ourselves, the other person. I think Torah study for me each week is also a deep listening. What is the text saying this year, which is different than previous years? And I want to bring it forward into my life as a physician right now. I also think listening is really important as healthcare professionals engage and partner with patients around COVID safety, which is the vaccine, but it's not just the vaccine. It's also wearing masks when out in public. It's not spending time with other people indoors with whom we are not living in a primary residence. It's hand washing. That engaging and first just asking, what do you know about keeping yourself safe from COVID? I want you to be healthy. And then just listening to what it is that people already know. People know a lot usually. And then reinforcing empathetically what it is that they're doing well. And then teaching an additional point. Would you be open to me adding to what you already have that is actually very wise? May I also tell you that the vaccine, both the Moderna and the Pfizer vaccine, are about 94 to 95% effective in preventing illness and especially severe illness. Were you aware of that? So then it goes back to the ask. What have you heard? Then responding with empathy. So it's what we call an art loop. Ask, respond, and then teach additional points. It's not a download. Downloads are dominating and disrespectful. I learned in medical school to be a downloader. I'm continuing to unlearn those kinds of dominating practices.
Do you feel like that there's a connection between learning to have conversations this way and the work that you've done, which I would love if you could share some of it, on working with conversations around equity, conversations around difference and diversity?
Yes, it's central. Oh, how I wish, Marcella, that someone had asked me, what is the climate like here in this group or organization in terms of racial equity, in terms of gender equity? No one's ever asked me that. And that's a loss because it's a part of my experience that's very salient to my well-being and my sense of inclusion. And so I'm coaching physicians nationally and now internationally. I have a workshop next week with faculty physicians in Israel. I'm very excited about this, to talk about microaggressions, the common everyday slights, verbal or nonverbal, intentional or unintentional, that target marginalized groups and reinforce social privilege. So we're going to be talking with about the impact in a medical education environment in Israel of microaggressions, whether they're related to cultural background, nation of origin, gender, profession is another one, where physicians are at the top of the hierarchy and other healthcare professionals not in medicine are lower in the hierarchy and therefore can be the subject of bias or discrimination. So it's going to be an exciting experience, and we've set it up so that they'll be giving us feedback at the end, like a focus group, so that we understand where, as Americans, my co-facilitator and I are both Americans, where we have provided useful teaching and facilitation and where we totally missed the boat because we're not Israeli and we don't understand the culture because we don't live in it. So much excitement. And another recent project, just yesterday evening, I sent out a national call to my colleagues in the Academy on Communication and Healthcare. I serve as VP for DEI in that organization. And I am offering an 8-week, 8-session, actually 16-week, 8-session workshop series on facilitating conversations about racial equity. And I wondered, well, will anyone sign up? And so far I have 14 responses in less than 24 hours. I'm very, very, very excited to facilitate in a humanistic, deeply listening way, while still holding my colleagues to a standard of respect, equity, taking into account a current social context as well as a historical social context, and that more can be done for us to lean in and listen to every member of the healthcare team, which includes the patient, the family. You've had that experience recently. The student, the professor, the administrator, so that we better develop respectful relationships and can work with each other in a deeply healing way.
Well, Dr. Davis, thank you so much for taking the time to give us your insights. And I wonder, do you have any final thoughts or anything else you wanted to leave us with?
Well, my thoughts are a refuah shlema, a complete healing for those who are ill, and whether that be body or soul, as the Jewish prayer says, and that we would be inspired to have deep conversations about people who know their minds and bodies, and with whom we could partner more deeply and more respectfully in their desire to be healthy and stay healthy. And let us say Amen.
Amen. Thank you so much.
Pleasure. I'm so happy to be with you.